How does international relocation affect access to public health care in Europe? In today's rapidly changing world, many Americans are considering relocating to Europe for work, retirement, or a new lifestyle. A pressing question arises: how does this move impact access to public health care? As more people search for information on this topic, it is essential to understand the nuances of healthcare systems across Europe. When Americans move to Europe, their access to public health care largely depends on the specific country's system and their residency status. Many European nations have public health care systems that provide high-quality medical services. These systems are often funded through taxes or social security contributions. For instance, in Portugal, the Serviço Nacional de Saúde, or National Health Service, offers most essential medical services either free or with minimal co-payments. Expats who legally resided in Portugal typically gain access to this system, particularly if they contribute to Social Security or hold residency permits. However, it is important to note that wait times for services can be longer in public healthcare systems. Many expats opt for private healthcare to receive quicker service and access English-speaking doctors. Private insurance is frequently used by expats to supplement public care, helping to reduce costs for private visits. Premiums for private insurance can vary but may sometimes be comparable to costs in the United States. Access to public health care in Europe usually requires legal residency or work permits. Americans moving for work often gain access through employer contributions to Social Security or national health insurance schemes. Retirees may need to register as residents and provide proof of health insurance or sufficient financial means. Some countries have bilateral agreements with the United States that can influence health care rights for Americans. However, these agreements can differ significantly from one country to another. The quality and accessibility of public health care can vary across Europe. Many countries offer universal or near-universal coverage for residents. Emergency care is generally available to all, including visitors. However, ongoing care typically requires legal residency and registration with the national system. In summary, Americans relocating to Europe can access public health care if they meet residency and insurance requirements. Many choose to complement public care with private insurance for quicker access and language convenience. Understanding the specific rules and healthcare structures of each country is essential for a smooth transition and maintaining healthcare coverage while living abroad.